Welcome to Lecto. Today we are going to discuss spinal cord. In this lecture, we will discuss the different components of the spinal cord, different coverings of the spinal cord, and the spinal nerves which arise from the spinal cord. So let's start. So first of all, we will discuss the different coverings of the spinal cord which actually protect the spinal cord. In our body, there are a lot of different protective mechanisms which protect the different organs of our body, like the ribs which protect our internal organ like the lungs and the heart. So same here, that brain is protected by the cranium. So same here, that spinal cord is also protected by the vertebral column. So here you can see section of the vertebral column, and in this section you will see that this is the ventral, or you can say anterior side of the vertebral column. And here you see that this is the dorsal, or you can say posterior side of the vertebral column. And here you can see these are different projections, and this is the disc which is present between the vertebra, which is called the intervertebral disc. So at the center, this is the whole vertebra surround the spinal cord. So here you can see at the center you will see the butterfly shape gray matter and surround the different white matters, and this is actually the spinal cord. This is actually the spinal cord. Next, you will see the different meninges which surround the spinal cord. So first meninges which actually touches the spinal cord is actually the pia mater. So this is the pia mater, which is the innermost meninges. Next, we see that second meninges is the arachnoid matter. Second is the arachnoid matter. So second meninges is arachnoid matter, and the last, which is the outermost meninges, is the dura mater. So here is the dura mater. Keep remember, in the brain there are two layers of the dura mater which surround the brain, but in the spinal cord you will see only one layer of the dura mater. So, and last, this one is actually last layer, which is actually the vertebra. This is the vertebra. So here you can see, you will see the different spaces, like outermost is the dura mater. There are two spaces which present above side and below side of the dura mater. So this space which is present between the vertebra and the dura mater, which is this space, is actually above side of the dura mater, and this space is actually called the epidural space. Epidural space, which is present above side of the dura mater. And next you will see that here you can see the space which is below the dura mater is called subdural space. Here you can see this is the subdural space. Subdural space, which is actually present below the dura mater. And you will see the arachnoid matter, and the space which is present below the arachnoid matter, here is the space, and this space is actually called the subarachnoid space. This is the subarachnoid space. This is subarachnoid space, in which you will see the cerebrospinal fluid. So this is the general overview, and you will see that the different spinal nerve, there are 31 pairs of the spinal nerves which arise from the spinal cord. So here you can see at the dorsal side, you will see that here you will see this is the dorsal root. There are two roots, dorsal roots and the ventral root. So here you will see that this, at the dorsal side you will see the dorsal root, and at the ventral side, or the anterior side, you will see the anterior root. So here are basically the two roots. And when they both the roots, dorsal root and the ventral root, combine together, then it will form the spinal nerves, which is actually the mixed nerve. This is the one root, and here you can see this is the same. Here you will see that this is the dorsal root, and again here you will see at this side you will also see this is the ventral root, and when they both combine to form the spinal nerve. So you will see this is the actually the one pair, and 31 pairs are present in the spinal cord. So here you can see that the dorsal root and the ventral root. There are two roots. Dorsal root, you will see in the dorsal root you will see the sensory neuron. And in the ventral you will see the motor neuron. This is the motor neuron. When both the root combine, they form the spinal nerve, and all the spinal nerves are basically mixed nerve, because both sensory and the motor neurons are present in it, so we call it mixed neuron. So this is the basic concept, and 31 pairs arise from the spinal cord. So this is basically the general overview, and you will see next we will discuss the different features of the spinal cord. These are basically the general feature. So first feature which we will discuss is the length. You will see the spinal cord length. So 45 centimeter and 42 centimeter. 45 centimeter length is present in the male. This is the male case, and this is in the female case. Female has relatively smaller length of the spinal cord. And keep remember, spinal cord is shorter than the vertebral column, and the length of the vertebral column length is the 65 centimeter, which is greater than the length of the spinal cord. And next we will discuss the weight of the spinal cord. If we talk about the weight, then the weight of the spinal cord is this 30 gram weight of the spinal cord. And next we will discuss the starting. First of all, at the top, medulla oblongata. After the medulla oblongata, spinal cord starts, and it will end at the conus medullaris. So you will see that the starting point is the medulla oblongata. So after the medulla oblongata, spinal cord start, and it will end in the conus medullaris. So this is actually the ending point of the spinal cord, and they are actually the conical in shape. And you will remember, conus medullaris end at the L1 level, lumbar 1 level in case of adult, and in case of children it will end at L3. This is in case of children. So spinal cord ends at L1 in case of adult and L3 in case of children. And this is basically the different features of the spinal cord. Next we will discuss the different spinal nerves. So first of all, here you can see that this central region is actually the spinal cord. This region is actually the spinal cord. Central portion is the spinal cord, and you will see that different sides region. This is actually the vertebra, and here these are also vertebra. They are not actually vertebra are not actually present in the pair. They are just the overview. When we cut the vertebra, then it will look like this. So actually vertebra are present in this shape, and different foramens are present in the vertebra, through which the pairs of the spinal nerves arise from the spinal cord. So always keep remember that the spinal nerves arise in pair. So here you can see we divide the vertebral column into different segments. So first of all, the first segment is the cervical region. Cervical region, in which you will see the 7 vertebra. In the cervical region you will see 7 vertebra. Next is the thoracic region, in which you will see the T1 to T12. 12 vertebra is present in the thoracic region. And next you will see the lumbar region. You will see the lumbar region, which is the L region, in which you will see the 5 vertebra. In that situation, L1 to L5, they are actually 5 in number. And next, if we talk, next is the sacrum region, in which you will again see the 5 vertebra, S1 to S5. But keep remember, sacrum vertebra are actually fused. So sacrum vertebra are actually fused in form. And next is the last is the coccygeal vertebra. These are actually 4 in number, CO1 to CO4. These are actually 4 in number, and these vertebra also in fused form. So sacrum vertebra fused form and coccygeal also in fused form. Coccygeal is actually bone is called the human tail. So these are basically the different vertebra, and the spinal cord present between these vertebra. And we also divide the spinal cord into different segments according to the vertebra, like the spinal cord segment of the spinal cord, which is present at the front side of the cervical region, is called the cervical segment, then thoracic segment, then lumbar segment, sacral, and coccygeal. So these are basically, we divide the spinal cord into different segments, and different spinal nerves arise from the spinal cord. So next we will discuss remember that spinal cord is relatively higher than the corresponding vertebra. Here you can see that you will see this is the vertebra level, and here is the spinal segment. Here is the spinal segment. So in that situation, first you will see that at C1 to C7, these are basically the vertebra, in which you will see the different segments of the spinal cord. What segment? C1 to C8. C1 to C8 segment is present in this region. C1 to C8 segments of the spinal cord lie between the C1 to C7 of the vertebra. Next, from the T1 to T6, from the T1 to T6 vertebra, you will see that what segments present? T1 to T8 segments of the spinal cord is present. So in that situation, you will see that the T1 to T8 segments of the spinal cord present in this region. Next, from the T7 to T9 of the vertebra, T7 to T9 of the vertebra, T7 to T9, you will see what segments? T9 to T12 of the spinal cord. So here is you will see that the T9 to T12 segments of the spinal cord. Next is the T10 and T12 segments. From the T10 to T12 segments, you will see how many segments of the spinal cord? From the L1 to L5. From the L1 to the L5. So L1 to L5 segments present in this region. And last is you will see 12 and L1. Thoracic, you will see the T12 to L1 region. T12 to L1 region, what segments are present? You will see from the S1 to S5 segments, and last is the coccygeal segment, and this coccygeal segment 1. So these are basically, we compare the different vertebra relative to the spinal segment. In that situation, you will see that the spinal segment is relatively higher than corresponding vertebra. So let's suppose that this greenish area is basically the lumbar segment of the spinal cord, and this is the lumbar vertebra. So here spinal segment is relatively higher than the lumbar vertebra. So this is actually the basic concept. Next we will discuss, as we know that the spinal nerves, there are 31 pair, and we name these spinal nerves according to the position, like cervical nerves, thoracic nerve, lumbar nerves, sacral and coccygeal. So the basic difference between the vertebra and a spinal cord, you will see that cervical, you will see the 8 nerves. In the cervical region, you will see the 8 pairs of the spinal nerves, and at the thoracic you will see the 12 pair. So and lumbar region, at the lumbar region you will see the 5 pair, and sacrum, if you talk about the sacrum, you also see the 5 pair, and last is the coccygeal region, which is 1 pair. So they all form the 31 pair. But the basic difference, there are 8 pairs of the spinal nerves and 7 vertebra. This is actually the difference point. 7 vertebra present in our body, but corresponding to the vertebra you will see the 8 cervical nerves. So now we will discuss in detail the nerves. So here you can see that the nerves actually arise from 2 parts. This is actually 2, dorsal root and ventral root. When they both combine to form a spinal nerve, and it arrives from at the upper side. Next, again you will see the dorsal and ventral, and it will pass between the intervertebral foramen. So here same case, this will continuous, and you will see that the different spinal nerves arise from the segments, and here you will see. So here you see that the dorsal and ventral root combine to form a mixed nerve, which is the spinal nerve, and they exit from the foramen. So this is the one side, and same as we discussed, the spinal nerves are present in pair. So this pair is complete if we see that this way. They are all present in pair, and they actually present in this way. So here you see that they, as we discussed, there are 8. So these are basically the 8 pairs of the spinal nerve. Next we discuss at the thoracic region we see the 12 pair. So as you see that 2 pairs of the, you will see this is the one pair, this is the 2, 3, same here 3, 4, 5, 10, and here you see T11, T12, and here. These are basically the different 12 pairs of the spinal nerves arise from the T region, thoracic region. So from the T1 to T12. And next is the lumbar. You will see the 5 pair. 5 pair means 10 nerves will arise. So here you will see that this way, this is this way, and they continuous throughout. Here you see that the different, you see, and same here we see this way and this way. So here these are basically the 5 pair. Next is again the sacrum spinal nerves arise, and they this way, they all pass through the respective foramen. Same here, that they also arise from the spinal sacrum segment and exit through the sacral vertebra. And last, coccygeal, which is the one pair, and you will see that they arise and they join with the coccygeal bone, and these are basically the joint form. So here you see that the sacrum bone is actually present in this way, triangular shape, and different foramens present at the sacrum region. This is actually the sacrum bone, and last is the, you will see, this is the coccygeal bone. They are actually present in fused form. So, and at the center you will see the sacrum hiatus. So these nerves are actually passed between the sacrum hiatus. Sacrum hiatus is basically a hole which is present in the sacrum bone, and different nerve pass through it. And last is the coccygeal nerve, which attached to the which pass through this region. First segments of the coccygeal bone. So this is the different spinal nerves. Important point is that you will see the in the spinal cord you will see the two enlargement. So here you will see that there at the position this way, at the position you will see the different enlargement. If we talk about the enlargement, so you will see two enlargement. First is the cervical. Cervical enlargement, in which you will see that at the position C4 to at the position T1, at the from segment C4 to T1 you will see the enlargement. At the level of the 6-4 you will see the maximum enlargement which is the 38 millimeter. This is the maximum diameter of the enlargement. And second enlargement you will see at the lumbar region. At that region you will see that here you can see that at the level of the L2 to and last it will S3. So this is basically the enlargement which start from the S2 and end with the S3. So in that situation, the maximum enlargement you will see at the S1, and the diameter will be 35 millimeter. So these are basically the two enlargement of the spinal cord. And keep remember that the spinal nerves provide the supply to the different limbs of our body, upper limbs and lower limbs. But the cervical nerves supply to the upper part like the face and the head and neck region. So these supply will be provided to the lower part of the body. So this is the different nerves, and you will see that the spinal cord and at the L1 level, as we discussed in the adult, spinal cord and at the L1 level. So next we will discuss the different modifications of the pyometer. So here you see that this is the pyometer. So first modification is the ligamentum denticulatum. So first modification is the ligamentum denticulatum. This is actually a fibrous bands that arise from the pyometers and attach to the dura or the arachnoid matter. So here you can easily understand that at that position, this is the pyometer. From the pyometer you will see the different fibrous bands. So here you see fibrous bands arise from the pyometer and join to the arachnoid or this dura matter, and at the both sides, and they actually support the spinal cord. So these are basically the bands that are triangular in shape. These bands actually support the spinal cord. So here is the spinal cord, and these bands are present in pair, and they support the spinal cord in the cerebrospinal fluid. So this band is very much important, and there are 21 pairs of the ligament denticulatum which support the actual spinal cord. And Next is the linea splendens. Linea splendens is actually the again this is a band which at you will see that is fine. This is the ventral side. At the ventral side, or you can say anterior side, you will see a sulcus. At this side you will see the anteromedian sulcus. Anteromedian sulcus, which is actually the groove, and in the groove you will see the antero spinal artery. You will see the artery, and around the artery you will see the linea splendens. You will see the linea splendens, which actually support the anterospinal artery. So anteromedian sulcus, in which you will see the anterospinal artery, and here you can see that this is the anterospinal artery, and this is surrounded by the linea splendens, which actually support the artery. So linea splendens support the anterospinal artery. And next is the filum terminale. Filum terminale is actually the projections of the pia mater. So here you can easily understand that the spinal cord end at the level of the L1. Lumbar 1 region. Keep remember that the L1 end at the spinal cord, and which is this is last region is the conus medullaris. So conus medullaris region of the spinal cord and at L1 level, and you will see the different layers. So here is the innermost layer, which is shown by the red color. You will see this is the pia mater. Next is the arachnoid mater. This is black color arachnoid mater, and last outermost is the dura mater. So keep remember, at the level of the S2, vertebra, you will see the ending of the dura mater. All the layers end at this region, and you also see that the only the pia mater terminate or extend downward, and it will join to the this way coccygeal bone. So in that situation you will see this way. You will see that the filum terminale is actually these two parts: externum filum terminale, externum and internum. This is actually the externum and internum. Filum terminale, the part of the filum terminale which is present in the arachnoid and the dura mater is called the filum terminale interna, and which is and the region of the filum terminale which is present outside the dura mater is called the filum terminale externa. So in that situation you will see that spinal cord end at the L1 level, and you will see different fibers arise from this region, and in that situation you will see in most situation we puncture at the lumbar region. So at below the L2 vertebra we mostly insert this syringe, and if we want to take this cerebrospinal fluid, and here you can see this is the space in which the cerebrospinal fluid is present, we mostly take the lumbar puncture, or we insert the syringe at the level of the lumbar below the L2 region, because spinal cord is not present as that region, and we easily take the cerebrospinal fluid without punching the spinal cord. And last point is the CAUDA equina. So here you can see below the L2 level at the coccygeal 1 level vertebra, you will see that the different spinal nerves form a mesh or form a collection, and they actually look like the hairs. So that's why we called it horse tail. So as we know that here you see that this is a horse, and you will see the tail. Horse tail has lot of hairs, and in that situation this region resemble the horse tail. So that's why we call the horse tail. This region, which is the CAUDA equina, which is actually present between the L2 to C1 coccygeal level, L2 to coccygeal level 1. This region has lot of nerves, and they actually look like the horse tail. That's why we called it a horse tail. In that situation, you will see that lumbar region L2 to L5 and sacrum S1 to S5, and last one is the coccygeal 1. So in that situation, you will see at the lumbar region you will see the four segment, and each segment has 4 roots. Each segment has 4 roots. Here you can see that, as we have discussed here, that the 2 roots and 2 pairs. Like if you see that these roots arise from the one segment, and here you can see how much root, 1 2 3 4. 4 roots arise from one segment. So if we have 4 segments, then each segment 4 roots will arise. So 4 multiply 4, 16. And in the sacrum region we have 5 segments, and from each segment 4 roots will arise. And if we multiply the 5 multiply 4, then it will be 20. And last is the coccygeal. This is the one segment, and this one segment has 4 roots, like this way. 4 roots, 2 dorsal and 2 ventral, and it will multiply by 4 and it will be 4. So overall you will see this is the 40 nerves root arise from the CAUDA equina. So CAUDA equina, you will see the 40 nerve root. So CAUDA equina is just like the structure which resemble the whole tail, and you will see a lot of different spinal nerves. So this is all about the spinal cord. If you have any question, then you may ask in the comment section. Thank you.